Okay, hello everyone, and welcome to Shifa Clinic's first outreach webinar. Today's topic is the Black Lives Matter movement, and we have an emphasis on racial health disparities, hence all the doctors here today. For those of you who do not know, Shifa Community Clinic is one of UC Davis's 9 student-run clinics that provides health services to those who don't have health insurance and to the underserved populations of Sacramento. Our clinic has a plethora of specialty clinics, including dental clinic, women health clinic, legal clinic, diabetic retinopathy clinic, mind clinic, dermatology, and podiatry. We see patients via telehealth appointments and in person every Sunday of the month, and you can schedule an appointment with us by calling our clinic at 916-441-6608 between Monday and Thursday. You have to leave your name, contact information, and the reason for your appointment. Our clinic is located on 419 V Street, right next to the V Street Mosque, and you can access this information also on our website at www.shifaclinic.org. Today, we're very excited about our presentation, and our guest speakers are joining us from the Sac Cultural Hub. We have the CEO and founder, Pleshette Robertson, Dr. Monica Crooks DDS with a private dental practice, Dr. Thomas Hopkins, who has a primary care practice in aesthetics, and Dr. Olivia Kasirye, a Sacramento County Public Health Officer of the city of Elk Grove, and they're all from the Black Physicians Forum. If you have any comments or questions during this presentation, please provide them in the comment section in the YouTube live stream, and then we'll respond to them after the presentations. So without further ado, please provide your attention to our wonderful speakers.
Thank you so much, Amal, Diana, Yasmin, and I'm Pleshette. I'm just so excited to be here. When I got the invitation from these very young students from Shifa Clinic, I was really excited to be able to come and talk about Sac Cultural Hub and how we reached and connect with the African American community here in the greater Sacramento Valley region, and then to talk more about the Black Physicians Forum. So without further ado, let's get right into the presentation, where I'm just going to basically introduce you to sacculturalhub.com, the Hub magazine, and the Sac Cultural Hub Media Foundation. Let's go ahead and go to the second slide, and we'll take a look at what we're going to cover in this very short time period. We're going to kind of giving you a snapshot of our profile, Sac Cultural Hub, who we are in the community, the Hub magazine, the foundation, and then some of the services that we offer, as well as go over some of the signature events with placing emphasis on the Black Physicians Forum, which I am just so glad to have our guest speakers, Dr. Crooks, Dr. Tom, and also Dr. Kasirye, who have been committed to Sac Cultural Hub and the Black Physicians Forum for now 10 years. And we'll be in a full discussion that Dr. Tom will go ahead and moderate on racial health disparities and the COVID-19 impact as it relates to African American communities. So go ahead and go to the next slide. Okay, so when we talk about sacculturalhub.com, the Hub magazine, what is it that we are here for? What is our purpose? Sac Cultural Hub started as a baby in 2002. I launched the website. 2006, we launched the magazine, and we provide civic engagement, non-traditional vehicles for media education and outreach. One of our specialties is we love to share stories and highlight the achievements of African Americans, and we like to see ourselves as serving as the grassroots multimedia marketing organization in Northern California. So please do check out our website. It really speaks for itself as far as being an entertainment vehicle, drawing people in, at the same time educating and providing lots of different resources that impact African Americans as individuals and their families. So let's go ahead to the second slide, the third slide, the next slide. So when we talk about how we actually connect deep into the community, we do that through our community and corporate sponsored corporate partnerships from a local level to a regional level and national level. Like I said, we launched the website in 2002, the Hub magazine in 2006, as we started to partner and do a lot of exhibitor events to get to introduce who we were, what we did at Black Expo events in partnership with the Sacramento Observer. And then we started with our Sac Cultural Hub Media Foundation in 2011, actually 2010. And that started with our annual signature events. Let's go ahead to the next slide. Before we get into our events, a little more about sacculturalhub.com, as well as what you might find on our website and what are the types of vehicles we use to actually connect with the African American community. Interactive blogs on our website. We have the e-blast. We're very known for our e-blast that we send out sometimes daily. We have an Urban Weekly e-newsletter, which is basically a mixed bag of information where people might receive job announcements, scholarship announcements, events that are coming up that impact them, and would be festivals and Black theater events and workshops and conferences in Sacramento, Bay Area, and even in Southern California and beyond. Our social media platform, we have Facebook, Twitter, Instagram, LinkedIn, and also YouTube, where this is another place where people congregate. They look forward to receiving announcements about what's going on in the community and how it impacts them, and interactive web videos. Let's go to the next slide. And our Hub magazine. So it's a quarterly publication, and here's where we share lots of stories that go untold in mainstream media on the local level of what's happening with young people, as well as, you know, older people and in between. Spotlighting exceptional women of color. Every year we do that issue and the fall issue where we have an actual big program. We award different women on their accomplishments in the community. And then we do a Sacramento Community Book Forum. And that's done in partnership with UC Davis. And then we do our Black Physicians Forum. So you can see all of the different things that are offered in the Hub magazine. We talk about events, political and health education, food reviews, restaurant reviews, featuring stories and career profiles. Just a plethora of resources in this magazine, as well as lots of good story articles. Let's go on to, we also do a Black Men in Leadership issue. This is our Black Music Month issue, okay? So again, that's quarterly. Let's go on to the next slide. And so this is where we, again, this is our Sac Cultural Media Foundation. We have 3 signature events. And these are fundraising events where we actually partnered with corporations, small businesses, nonprofit educations who advocate for awareness and education of relevant issues that impact African Americans. We're coming up with our 12th annual Exceptional Women of Color Virtual Awards Summit and Expo. We also are going to be having a Sacramento Community Book Forum next year. We just celebrated 10 years, as I talked about, for the Black Physicians Forum, and it was a virtual summit addressing the maternal health crisis. And so Dr. Kasirye, she actually participated as a guest speaker, and that was in June. Let's go to our next slide as we jump right into our guest speakers today. I am so grateful and so honored to be able to present to you all Dr. Olivia Kasirye, Dr. Thomas Hopkins, and Dr. Monica Crooks. As you see, they were introduced at the top of this presentation. They are going to actually go into a full discussion on racial health disparities and COVID-19 as it relates to the Black community in the greater Sacramento Valley region. Dr. Tom, are you there?
Everyone. I would say one thing about Pleshette and her organization has really done an outstanding job and continues to be on the forefront of, educating the African American community at large about all of the services that are available. So as we launch into the discussion about racial disparities and the things that are going on with COVID-19, I think it's very important to understand that this organization, if you look at all of the agendas for the topics for the Physicians Forum, they all related to this very topic, I think, of trying to level the playing field with racial disparities. So our panel, as me being moderator, and opening up this topic, I think that Dr. Kasirye, who is on the front lines about where the numbers are that are in our community. And I would like to start off by, really having her have just define what she thinks and describes the scope of the issue in our region. Dr. Kasirye?
Well, thank you. And thank you, Pleshette, for the invitation. Good morning, everyone. And I guess all of you are very aware of what we're dealing with COVID-19, but just wanted to give a very brief summary, and especially talking about where we're seeing the trends and some of the things that public health is doing to try and mitigate and fight this pandemic that has impacted all of our lives. So right now, as of this morning, we have reported at 15,246 cases of COVID-19 in Sacramento County. When you look by age, about 60% of those are in the age group 18 to 49, which is no surprise because this is the age group that is getting out and about. They're the ones who are working. They're the ones who are going to gatherings and parties. And so that's where we're seeing the largest percentage of cases. When you look at the deaths, 204, 75% of those are people over the age of 65. And the reason for that is people over the age of 65 are very vulnerable to severe disease when they get COVID-19, and they're most likely to have adverse outcomes and death. When you look at by race ethnicity, about a third of the cases are white or Caucasian, about a third of them are Hispanic, and about 14% are African American. Those numbers have changed over time because when this pandemic first started way back in March, a lot of the cases we were seeing were actually in long-term care facilities. So we were seeing like close to 90% of our cases were actually Caucasian. But credit to the African American committee that actually wrote to the Board of Supervisors and requested, because they were seeing what was happening in other parts of the country, and requested that there be more testing sites available for disadvantaged communities. So at that time, actually, they started meeting on a regular basis with county executive representatives and talking about the needs in these disadvantaged communities, and also how to make sure that testing was more readily available. So over time, after the shutdown, as we started reopening, we started seeing a change in the people who were impacted. And especially at that time, that's when we started seeing the disparities for Black and Brown people. And that's where we started seeing a huge increase for Hispanic people, as well as for the African American. And there are a lot of reasons for that. Part of it is because of many of them work in essential services. And so they had to go to work. They did not have the option of telecommuting. Some of them, especially in service areas, or for example, those working in agriculture, it's very difficult to maintain social distancing even at work. And many of them also did not have the luxury of sick leave. And so many of them would show up to work even when they had mild symptoms because maybe they were the only breadwinner in the family. So all of those factors, plus the fact that for many of them, they lived in larger households. And so when one person got infected, it was very easy to spread to others because isolation was next to impossible. So all of those are factors that contributed to the increase that we were seeing and the increase in disparities. So what are we doing right now and public health to try and mitigate? As I mentioned, we're continuing to work with the African American Committee as they bring these issues to us. We recently, thank you to the entire community, were awarded 45 million by the Board of Supervisors that we're working really hard to get out to increase testing. We now have 10 testing sites in the community, and many of them are in places where the disadvantaged communities that wouldn't otherwise be able to access the testing, such as North Highlands, downtown Sacramento, even as far down as Galt and Folsom. So making sure that people have access to free testing so that if they are exposed or if they're exhibiting symptoms, they can easily access these services. We are also working with this new money to work with community-based agencies to provide wraparound services, which are really important because, as I mentioned, for some people, it's very difficult to isolate when they get sick because they live in a large household. And for some, it's very difficult to take time off. So, and then we know that COVID-19 has also affected people in a lot of different ways. Some people have lost their jobs. Some people, it's very difficult for them to find food. So being able to provide all of these resources. So looking forward to the next 4 months as we work with our community-based agencies to turn this around again and get our numbers down.
Thank you for that, Dr. Kasirye. You know, I'm going to bring in Dr. Crooks into the conversation, really looking at, with all of the numbers that Dr. Kasirye has outlined and things that are going on in our community, describe what your office and what your profession in the dental industry and how that has been impacted with closures and what are the steps have you had to mitigate that so you can continue to deliver high quality care to your patients? Dr. Crooks?
Unmute, sorry. Okay, so you're speaking specifically on how it has affected me and my delivery of service, correct?
Correct.
Okay, all right. So the thing about the dental environment is we are nose to nose with our patients, and therefore we are infection control experts. We are worried about every pathogen, not just COVID. So there's TB, there's hepatitis, there's AIDS, there are countless pathogens that we're constantly worried about. COVID really is not that different. What we have done that's different is we always wear our shield now. It's not that the shield is new. We had shields before. We just didn't always use them. We always wear a mask, but now we wear the mask and the shield, okay? Nothing's coming through the shield. It's plastic. It's a nice, thick, hefty piece of plastic. And you have the surgical mask or the N95 underneath that. So the patient's not getting anything from me, and I'm not getting anything from the patient. I feel very comfortable in my arena relative to COVID, okay? We also, you know, like everyone else, we are screening our patients. So anyone who has any temperature of any sort, I mean, that's elevated, anybody with a 99 and above, we wouldn't see, period, you know? So, and we tell them this in advance. If you have a fever, you can't come, you know? So your temperature has to be normal. And you cannot have been around anyone who's ill, even if they're ill and you don't know what their illness is, meaning sneezing, coughing, anything that sounds like the flu or feels or seems like the flu or cold. we don't see anybody who's been around anyone with those symptoms. And every time we see a patient, they have to sign a waiver that verifies that they have been away from anyone like that and not had those symptoms for the last 14 days.
Great.
So I feel very, very comfortable in my arena. I don't feel that I don't feel I've seen anyone with active COVID, but talking about disparities in the African American community, what I see as a dentist just over the course of my career is a higher degree of lack of education about oral hygiene. I mean, dental disease is 100% preventable. And I tell all my patients this, okay? Dental disease is 100% preventable. It's all about hygiene. And if patients or if people get that message early enough in life and take it to heart and actually do a good job at home and come in on a regular basis for a professional to basically act as your coach, you will have no dental problems, period. That's the truth. And it comes as a big surprise to most people. And unfortunately, there's a fair number, especially in the African American community, where that message has been delivered too late. Because in the last generation, our parents probably, or maybe parents didn't have the education, didn't have access to care. Nobody told them to floss and brush. Nobody went to the dentist. And when they did, especially in, I'd say the South, it's horrible. If they had a problem, the only solution was to take the tooth out. So that's the disparity that I see in the African American population that I serve.
Thank you. Thank you. Dr. Kasirye, I'm going to bring in this from what you've heard from Dr. Crooks, and you're talking about, the disparities. What really resonates with me with COVID now is that all of these very same issues have been ongoing for a long time, that we still have problems with, social disparities, implicit bias being one of the things that has been a driver of that. And I know that we had that in the last physician forum. But what do you see as, from a public health standpoint, with not only just with COVID and the pandemic, what is the keys to having us continue to battle with ending racial disparities in health? What do you think are some of the keys?
One of the things that I see is that it's not just one factor. Mm-hmm. And in order to deal with it, we need to have, a lot of people at the table to discuss the different issues, and also the recognition of just how pervasive systemic racism is and how it impacts people all the way from birth to the time of their death. And just to give you an example, Pleshette mentioned that the last time we were talking about pregnant moms and the disparities there. And we talked about how pregnant moms often feel that they're not heard when they go to see a doctor. They have less access to care to begin with. And all of those contribute to their not being able to have good outcomes from their pregnancies. They're also at higher risk of a lot of chronic diseases that put them at risk. And actually, we've seen that happen even with COVID-19. Yeah. Diseases like diabetes, hypertension, kidney disease. Those are all diseases that put people at risk. I mentioned that with the deaths, 75% are in people over the age of 65. But when you look at the deaths we've had in people less than 65, these chronic diseases are like, it's every single time we get a hospital report, you can be sure that those are the things that are going to come across. And we know that these diseases are much higher rates among Black and Brown people for various reasons, because of the stress, because of the lack of access to care. And all of this can be tied back to some of the barriers they have because of systemic racism, lack of access to education, and the feeling of hopelessness, because even in education, which is one of the main factors that helps people actually overcome some of these disparities, a lot of our young people, they feel disenfranchised, they drop out of school, they don't feel like it's relevant for them, they don't have access to good education. And even now with COVID-19, with the reality that we're not able to safely open our schools, what is happening with the distance learning is for the schools that have more resources, are more able to provide distance learning adequately to their students, whereas children that are living in disadvantaged communities may not have access to Wi-Fi, may not have access to the Chromebooks and laptops. And all of those are factors that are impacting them right now, but actually may impact them far into the future because of the gap that has occurred. And I know that we've had a lot of questions from people asking, well, why are you, not opening up the schools? But for a couple of reasons. One, we know that the teachers who are in the schools also do need to be protected. And if we open the schools when we don't have a good system in place to protect them, and we've seen this happen in a number of schools in other places where they open up and soon after that have to close because they have an outbreak. And our teachers, many of them are in these high-risk groups. So it a lot of factors, but I think the main thing or take-home message is that we need to realize how pervasive systemic racism is, and that we need to deal with it in order to be able to deal with the factors that we're talking about right now. The fact that people don't have education about oral health and oral care, the fact that a large percentage of minority groups have chronic diseases, and the fact that many of them don't have access to good health, good education, and good jobs, and even the basics of good food, because they often live in food deserts. So we need to be able to call it what it is, address it, and that's how we'll be able to move forward.
Yeah. Thank you for that comment. I'm going to relate back to the question for myself in my practice. I'm board certified internal medicine physician, so primary care is the main thing that I do. And of course, obviously, it's all about all the impacts that I participate in for community health. I would have to say one thing that that is not really pointed out as all the good side, and I think I would like to hear, Dr. Kasirye, your comment about that when you look at the numbers, because in my practice, I would say I've had probably 2 patients overall of my practice that have tested positive that I knew of, that I was directly involved with. And now I'm in Placer County where my practice is, but I live in Sacramento County. And I really want to reflect on the fact that even though we see a lot of things that are going on nationally, and I'm involved with Sutter Health and the hospital system, our numbers are not like we're seeing in different areas, from our death rates to our hospitalizations, but our number of cases have gone up. So really, they have gone up and now have leveled off. As a public health officer, how do you balance with saying, have we done a good job in we're speaking about our areas, our surrounding areas. Have we done a good job with all of this that's going on, that we, in our numbers with our at-risk populations, African Americans, people of color, in terms of our hospitalization death rate, and number of cases, how well have we done? Highlight that. It seems to me, I think people have been doing a pretty good job and have been following some of the guidelines that have been from state and local. Could you reflect on that, Dr.?
So one thing I'll say, it's hard actually to say whether we've done a good job or not, because when I look at the numbers, I worry a lot about the trends, and I'd like to see them going down faster. But one thing that I'd like to comment on is the people that I have talked to in some of these neighborhoods, the disadvantaged neighborhoods, one thing that has impressed me is how willing they are to do the right thing. And all of them have been asking, what do we need to do to protect our communities? How can we get face coverings? What do we need to do in our churches to make sure that we protect the most vulnerable? We have, I've had calls with people who said that when they realized that the isolation was impacting some of their younger congregants, they set up a system where they make regular calls to make sure that they keep in touch with people and try to make sure that they're not adversely impacted by the fact that they have to stay indoors. So it's difficult for me to say whether we've done well or not, because I wish that our numbers were where we were at in April, where we were getting only 10 cases a day. Right now we're getting about 250 a day. But I think that on the individual basis, what has impressed me is that a lot of the people that I have talked to in these disadvantaged communities want to do the right thing.
Right.
And they just want to be able to get access to the what they need to be able to remain isolated, to do the social distancing and face covering. And as I mentioned also, many of them, the reason that they get infected is not because they are being reckless. It's because for many of them, they are living in overcrowded houses, or they're living, or they have to go to work. They don't have the option of telecommuting because of the
Right.
type of work that they do. And so that does put them at risk. And that's why we keep putting the message out that we all need to work together. This is not just up to public health to solve, because I could yell all I want about the need for social distancing. But if people are not doing that, if people continue to go to gatherings, to birthday parties, it's all for naught, because the virus doesn't care. It'll just keep spreading if there's an opportunity for it.
Yeah, I think that well said there. I guess for me, I try to, if I just focus on the numbers and anything, even if it's a patient that I have that has diabetes, is not controlled. But if I focus on the numbers, I miss out so much on the importance of the education, that they, that there's always an opportunity for that people to do better. And I think that's where it lies with the personal responsibility message that we are, wherever you come from socioeconomically, that you're having that discussion about what we're all in it together, and then what as each individual can do to limit the spread of COVID-19 and other diseases, if you will. Dr. Crooks, what do you see? How do you get the message? You said something that's very important to me that I want to build up on. The fact is that, my dentist, who's right across the hall from me, their practice was gone for a long time. I mean, because of COVID, they shut down, then they were granted to open, as if dental services were not essential. And like you said, I thought all along that the folks who were poised and already were doing what they should have been doing was the dental profession. So my office was open, and we made some great changes, but the dental office was closed when they already had a lot of these things in place. Could you comment on that and where we are with that, in the message of, patients, hey, don't fear going to your dentist, don't fear going to your doctor's office?
Sure. Okay. So the real reason, whether the news tells you this or not, that we were asked to shut down, that you were asked to shut down, is this country did not have enough PPE to cover the frontline workers, period. If we had all been working, they would not have had enough resources to see the people who actually had that disease. That's the real reason we were asked to shut down, because we weren't really shut down. We were always available to emergency patients, you see. So we were caught with in a very embarrassing situation. The United States, I'm talking about, because we had outsourced the manufacture of all of those essential goods, and we just didn't have them. That's the real reason.
Yeah, I understand. And that's interesting because I've never closed. My practice, we never shut down. Because what I was seeing in my practice, and I would say, there was this big focus on COVID-19 when all of the other diseases did not go away.
Right.
Diabetes didn't go away, kidney disease didn't go away.
Right.
And so it's had more patients that suffered the consequences of the disease they already had as they feared the disease that they did not have.
Exactly.
So again, that message for my practice and to get out there and educate and personal responsibility and adhering to guidelines. Because I think that if I looked at the same factors that they say for COVID-19, our pandemic, while people of color are adversely affected, they're the same reasons that happen, why is diabetes, obesity in our society. They're the same. You know, discrimination, racism, the access to healthcare, the jobs that you work in, as Dr. Kasirye mentioned, where some of those things are not able to do. I look at going back to schools, you pointed to, there's going to be this gap. There's always been a wealth gap we're talking about. Now, COVID-19 and the closing and not opening of schools and where resources aren't equal, you're going to see gaps in the knowledge gap that's going to occur as well. So anyway, I think there's a lot of those factors, but I always go down to the end of the day is how everybody who's on this this call, and even for the clinics that are staffed by the students, the medical clinic at UC Davis, everybody's kind of doing their part, and we at least have to, the people that are in front of us that we're taking care of, how we impart to them the importance of, you know, personal responsibility in remedying some of these things, because we, as Dr. Kasirye said, you can't leave it to public health to do it alone. You know, I'm in the private sector, Dr. Cook, we're in the private sector. We have to continue to kind of advocate for this type of change. But Pleshette, I don't know about
Can I make one more comment, Dr. Tom? Can I make one more comment?
Sure.
Okay, so notice that when statistics occur, they lump all African Americans as one group. Okay, it's like one African Americans, this and such and so is true. They don't break it down, and I appreciate very much that Dr. Kasirye did. All of the mitigating factors that go into, they're not looking at African Americans in higher socioeconomic groups and splitting them off, because I bet they don't have these problems, okay? They're not looking at African Americans in higher educational brackets. That they don't have these problems. They just lump everybody together and make this big blanket statement. That always happens. It happened in dental school, in pathology class, when they said Blacks have this disease more than everybody. You know, it's like, it's not a genetic predisposition. It is a disadvantaged predisposition.
Yeah, that's based on a whole bunch of factors.
So many factors involved, just like Dr. Kasirye said, very multifaceted problem.
Absolutely. And so when you look at anything that's multifaceted, it's going to take multiple ways that you intervene to mitigate a problem.
Right.
And I think that's what my point of all of this is, that it has not, we're continuing to make strides in doing this, whether COVID comes along. And I think really, the good thing about that, it really highlights what we already been saying and we already know. And the question is, how do we move forward to saying what's going to be done with it, with all the things that we're working on? So, you know, ending discrimination and pointing out, you know, racism that happens in healthcare, continuing to build on the access that we have to care, and the education. So the education is to really level the playing field of knowledge, and then also the resources and things that brought into, yeah, you're right. We know, like if I say one of the differences, I would say that we already know, and the data I don't think lies, but people do, is really what happens. Exactly. And the more if we break it down and know what specifically the stats and the data shows, it will indicate where we have opportunities to make change. Pleshette, I don't know about the other questions if there's other questions that were going to be from your audience, to entertain those, just being respectful of the time we have.
Oh, are you talking to me, Dr. Tom?
Yeah, I didn't know if there's other questions that
Okay, yeah, I think we are coming to a close here. The Shifa Clinic, they have some great services that they want to talk about. And I was just, so involved in the discussion. I kind of got lost there, but you guys have done a fantastic job, Dr. Crooks, Dr. Kasirye, Dr. Tom, in moving through that discussion and providing so much good information about the COVID-19 impact, especially with our testing centers, how we should think about moving forward. It's really good to hear from Dr. Crooks about her practice and how important it is that, we, pay attention to our dental needs in this crisis that we're in. Don't fear going to the dentist. And I'm so glad to see that you're still seeing patients, and was surprised to know, Dr. Tom, that only 2 patients tested positive at your clinic. So again, I am with you on what we need to do in moving forward, though, in making sure that our community, everyone is very aware of the testing centers. Get tested if you have symptoms. Practice social distancing. This is very important, what Dr. Kasirye is talking about. Not, going to big parties that we see on TV where college students are gathering together, because I know everyone is getting restless. And it's a tough time. It really is a tough time, especially for young people. Now, I'm old, so I like being at home. And it's not important for me to go to large gatherings and so forth. We just don't know how long we're going to be in this time period. But I did want Diana or Amal to go to the next slide. And as we do come to a close here, I just wanted everyone to see all of the different topics that the physicians here today have been very involved in the planning, the participation. Since 2011, actually, we created, it was Black Physicians Forum was actually initiated with Chet Hewitt and the Sierra Health Foundation. That's where the Black Physicians Forum was born, in creation with Sac Cultural Hub Media Foundation. Our first forum was at the Sierra Health Foundation in 2011. And then we found a home with UC Davis Health Office for Health Equity, Diversity, and Inclusion through the leadership of Dr. Adrian Lawson, Dr. Hendry Ton, and of course, Dr. Darren Lattimore, who Dr. Lattimore actually received another job. He got another calling to go back east. And he's actually working at a university back east. The name escapes me now, but he was actually on our virtual forum we had as a guest, listening to the 10th annual virtual forum in June. So all of these physicians have been very instrumental in making sure to educate our community, give context to what is happening, how it is impacting individuals and families, and how we can take preventive measures when it comes to our health. So definitely wanted to give a shout out to them. You can see all the various subjects we've covered when it comes to cancer prevention, heart disease, diabetes, hypertension, HIV and AIDS in our community, the legalization of marijuana, violence as a public health issue, drug addiction and substance abuse, implicit bias, as Dr. Tom mentioned, Dr. Kasirye mentioned, maternal health crisis, and improving health inequities overall. So with that said, again, I want to thank the Shifa Clinic. This has been great awareness, because I went through all of the different information on the slides beforehand, and to know all of these different services that are offered by the Shifa Clinic is outstanding. And I know they're going to go through those services. It's important for us to share this video, like our YouTube discussion, and make sure that other people are aware of these resources, because it's just good information for us to know. And not, my thing is, there's no reason why people shouldn't know if it's people like us that are sharing the information. Okay, share on your Facebook and talk about this with your family members so they know, about this information. So again, thank you, the team of Shifa for inviting us. And if our doctors have any closing remarks.
Yeah, I'll start off with a closing remark as well. I'm always so hopeful, thankful, prayerful that we all, if everybody else kind of bands together and connects together on all of these issues, that we will overcome. And I do really want to thank the public health sector in terms of my realm of what I've done more on the private sector, but for sharing the accurate information, continuing to hone the message. I think especially with during this pandemic of wearing masks, facial coverings, social distancing, washing your hands, and just keeping a good healthy germ-free environment as much as possible. So I really want to thank the public sector for doing that. And I'm also really for the people who I say are on the front lines, all our essential workers, our dental folks, really trying to we're all on this and making sure that, helping people are just so fearful. So the thing for me is just helping facts, the good facts to overcome their fears so that folks can be safe. They can continue to be educated so they can continue to improve their health. So that's my final comment. Dr. Kasirye, you have a comment?
Yes, I guess the one word that I can say is hope. I think these are difficult and unprecedented times, but what's going to take us through is working together and also continuing to have hope and looking at how we can overcome all of these challenges. So thank you again for the invitation. And I just want to thank the public again for everything that they're doing and listening to us and trying to do the right thing. And thank you, Shifa, also for this invitation and for the work that you do.
Dr. Crooks?
Yes, okay, so thank you to everyone who put this together. It's an excellent idea and we need to do more of it. I have a question for Pleshette. Does Sac Hub have a directory? Because here's what I feel. I feel we need to, I love all people, all races, all ethnicities, love my white folks too, okay? But we need to stop relying on anybody else to solve our problems. We have enough educated and empowered and financially empowered people of color that we can take care of ourselves, okay? And we can teach our own people and we don't have to rely on anybody else. So do we have a directory, a business directory where we can kind of support each other? Does that exist with Sac Hub?
So short answer, no. But when we talk about, we are in the works of creating this in a partnership with the California, am I muted?
Nope. Oh, now you are.
All right, so yes, I do want to say that we do have a physicians directory, and I will on the YouTube Shifa page, we have a referral directory of Black physicians.
Good.
We definitely have that. I will put a link where people can access that link online. Mm-hmm. We are actually working in partnership with some other Black organizations in Sacramento and throughout the state of California to put together a Black business directory. They do exist, but they're in somewhat of a paper form. We need a data book-based form because nothing is really current. So this is what we're working on to make it a database of all Black businesses across the state. Now, you can find Black business owners and entrepreneurs through the Sacramento Black Chamber of Commerce and also the California Black Chamber of Commerce. But as far as a centralized database for, the thousands, the hundreds of thousands throughout the state of California, that is a work in progress.
Okay.
Thank
And
you.
then one thing I'd like to say, I am going to commit myself to writing an article for you that educates people about dentistry, the importance of dentistry, the connection between your mouth and the rest of your body. It's not isolated, okay? It's connected to all the rest of it, can influence your health, your heart health and your lung health and diabetes, all of it. It's all connected. So I will put something out towards that. And I would like to ask of the other two doctors who are on this panel if you would join me in doing something like that, so that we can put together what we want the community to learn, to hear, and then let's find a way to push that out. I mean, get that message to other organizations so that people know in general.
Absolutely.
Excellent idea, Dr. Crooks.
Yeah. Okay.
All righty.
Thank you, everyone.
Well, thank you, everyone. Everybody be safe and healthy.
Okay.
We actually, we actually had a question on our YouTube page for Dr. Kasirye, and someone wanted to know if the homeless population is being tested for COVID-19 and the figures you shared, if they're reflective of that.
Thank you for that question. Yes, we are. We have a team that is going out to the shelters and the unsheltered homeless and offering testing. I don't have the figures of how many have been tested, but fortunately, we know that that community has, for one reason or another, been protected. We've had only maybe less than 20 that have tested positive, and for the most part, all of them have had very mild symptoms. So we continue to work. There is a team that is actually working, and there's a program called Project Room Key that is providing housing for them, and as well as wraparound services. The city also has a project where they are providing trailers where if someone needs to be isolated, they can actually be isolated. So I think in Sacramento, we have a good program in place to be able to take care of the homeless right now.
Okay, thank you so much. We wanted to thank you so much for the very informative, engaging presentation. I feel like you all shined light on a lot of topics that people aren't very aware of, and since you're on the front lines and you're seeing it in person, it's very beneficial to our community to have this knowledge available to us like this. So we thank you so much for being here today. If anyone has any more questions, please feel free to email us. And we want to thank our speakers for taking the time to be here on a Saturday. And we will finish off this presentation in this webinar by providing you with some resources you can use to help yourself and others.
Thank you, Amal. Thank you, everyone at Shifa.
All righty. Bye-bye.
Let's stay on.
Bye.
Bye-bye, everyone. Have a great weekend, Dr. Crooks, Kasirye, and Dr. Tom. Thank you for being here today.
Okay. Bye-bye. Thanks for having me.
Bye-bye.
Bye-bye.
Okay, thank you, everybody. Thank you, Amal. As mentioned, we have also gathered some resources that can help the community. For example, My Benefits encompasses the following programs: CalFresh, Medi-Cal, and CalWorks. These programs provide aid through food assistance, healthcare, and cash aid, respectively. You can apply online through the website we have provided, or you can also submit your documents via mail. The other program, WIC, the Special Supplement Nutrition Program for Women, Infants, and Children, is a federal assistance program of the Food and Nutrition Services of the United States Department of Agriculture. This program provides health care and nutrition for low-income pregnant women, breastfeeding women, and children under the age of 5 to be eligible applicants that can go ahead and look online the URL we have provided and to see if they meet the criteria. If you'd like to apply, you can go online through the website that we have provided on the PowerPoint. We have also gathered 3 websites that define a food desert and projects that will help the low-income neighborhoods. The first website, United States Department of Registration Economic Research Services, defines food access, low-income neighborhoods, low-access census tract, and food deserts. To access more information, you can search online and type in the URL that we have provided as well. The next website, Food Empowerment Project, encourages healthier food choices and highlights things such as unfair working conditions for workers and the availability of health foods in low-income areas. To access more information, we have provided the website as well. The last website, Food Literacy Center, Their mission is to inspire kids to eat healthier and teach children from low-income elementary schools to cook and garden and the importance of nutrition and exercise. For more information, we also provided their website as well. You can go next slide. Okay. In addition, we have provided 3 organizations that provide legal services. The following are Legal Services of Northern California. This organization has been fighting for the civil rights of their low-income clients for over 60 years. The second organization, Volunteer Legal Services 2 Program, is a volunteer-based organization that provides free assistance with civil legal matters to low-income clients living in the Sacramento area. For more information about this organization, you can contact them via their phone number or their website. The third organization, California Lawyers for the Art, empowers the creative community by providing education, representation, and dispute resolution. For more information on this organization, you can also contact them via their phone number and website. Below each organization is their contact information if you need them. Okay. Lastly, to access any health ed resource, you can follow these steps. Step 1, you can open up your browser, type in your search bar, shifaclinic.org, and press enter. Step 2, the Shifa Clinic homepage will appear and look for the tab named Health Services. Under that tab, a down bar should appear and click on Health Education. Okay, step 4, the Health Education page will appear and you can click on any PDFs or videos. For example, to access the resource called Busting Myths, you would just need to click on the rectangle shape on Busting Myths. Step 5, finally, the PDF on Busting Myths will appear. Okay, so this is the end of our Black Lives Matter movement webinar on racial health disparities. Thank you, Pleshette and Dr. Olivia Kasirye, Dr. Thomas Hopkins, and Dr. Monica Crooks for joining us today. Please tune in to our next webinar as Shifa Clinic presents Safely Assimilating Back into Society During the COVID-19 Pandemic. This will take place on the same YouTube channel, Shifa Clinic, on Saturday, September 19 at 4 p.m. Presenting will be Dr. Kravitz, MD, and Dr. Garcia, Dr. PH and MPH. Thank you, everybody.
I would like to thank Pleshette for taking the time to join with us and being so communicative and volunteering her time in order to join us in this webinar for this very important cause. And I'd like to thank all of the doctors that were guest speakers who joined us today. And I'd also like to thank all of our viewers today who have taken the time to come in and learn
Diana,
more about this movement.
I have a question.
Yes.
Diana, you know, I'm so sorry, I forgot to mention, is there any way that as you close out, would you be able to, because it gives more context, the video link on Black Physicians Forum? I totally forgot about the.
No worries at all. It's in the
Okay.
slides and I'll go ahead and play it at the very
All
end.
right.
So thank you to all the viewers for coming in today and watching our first ever webinar. And we'll close it out with a video on Sac Cultural Hub in order to gain more information about it. And thank you, Pleshette, for taking the time to join us. Here's the video.
Heart disease, diabetes, tobacco use. Those are just a few examples of health inequities within the African American community. So what does UC Davis School of Medicine, Sac Cultural Hub Media Company, and Sierra Health Foundation all have in common? The common goal of connecting physicians who are reducing those disparities within the urban community. Well.
I think what's so awesome is that Pleshette and many folks have been working on convening our Black physicians. This is our third year we've been able to do it. We have over 200 physicians from Northern California that are here. And we all know that the African American community, when it comes to heart conditions and blood pressure and diabetes, our risk level is at the top.
Yeah.
And a lot of things can be corrected if we just have awareness and do prevention and get educated properly. And that's what this is really about.
Hello, we're here at the Black Physicians Forum talking with Dr. Wesley Clark about the Adult Use Marijuana Act and the impact of it passing in California on the health of African Americans.
What we can predict is that there will probably be an uptick in use by young adults and some diffusion of that use into adolescents. How is that going to impact the health of individuals? Depending upon the level of use, depending upon the factors associated with that use, whether the person is using other substances, whether the person has psychological issues like depression, psychosis, and the use may precipitate some other complications.
Okay, I'm standing here with Dr. Yinka Davis. Thank you so much for joining us this evening. Now, what do you feel is the key role of African American physicians today when seeing and treating African American patients?
And particularly for me, it's obesity. So as a pediatric gastroenterologist, I deal with this on a daily basis. And seeing the kids coming in and seeing our children that are actually now 40% prevalence of obesity amongst African American children is a place where I think I can actually do some prevention and some education towards our kids.
Hi, I'm Dr. Valerie Yerger. I'm a naturopathic doctor and a assistant professor in health policy at the University of California at San Francisco. So during the last several years, I've gathered quite a bit of expertise observing how it is that the tobacco industry systematically targets African American communities.
Thank you again, Diana. That was wonderful. Thank you. This has been fantastic. So glad that you guys organized this forum. It has been really, really good. Very well organized. Very, I see on YouTube, well attended. So I'm glad that Sac Cultural Hub could be involved.
Thank you so much for volunteering and being involved. And we're very grateful that we were able to work with you.
All right. You all have a great weekend.
You too. Thank you.
Bye-bye.
Bye-bye. Thank you to all the viewers.